Diet and multiple sclerosis. Today I want to tell you some stories about some of my patients and how their MS has gone and the diets they've attempted. Of course, this is not a scientific presentation. Individual anecdotes don't mean too much, as there could be many factors other than diet influencing people's results, and of course there are some biases of which stories I remember. Nonetheless, I think it's interesting to talk about and could help us generate hypotheses for future research, and I'd encourage you to talk about your history of MS and what diets you've attempted and your results in the comments below. To start with a conflict of interest statement, no one is paying me to make this video. I have interviewed Dr. Terry Walls multiple times on this channel. She advocates for a paleo type diet. I also have a relationship with Professor George Jelinek, the author of Overcoming Multiple Sclerosis, who advocates a whole foods plant-based diet plus seafood. We're even doing a research project together, which I'll explain at the end of this video. My name is Brandon Beaber. I make videos about MS every Wednesday. And my first story is a patient who's a young gentleman in his early 40s now, has relapsing MS, and he was diagnosed with low disability, started on highly effective disease-modifying therapy, and he's done well. And many people in this situation do well regardless of diet. Now, I saw him one visit, and I said to him, "You know, you look lean, like you lost a lot of weight." He used to be obese. And he said, "Yeah, I lost 100 pounds. And he said it in the most casual way, as though it was nothing. And I asked him, "How did you do it?" And he said, "Well, I've been keeping a whole foods plant-based diet." But then I asked him specifically what he was eating, and he said, "Yeah, I'm eating a lot of chicken and fish and, a lot of vegetables and fruit." And he really wasn't keeping any specific diet at all, certainly not a whole foods plant-based diet. He was essentially just avoiding processed food and eating more whole foods, whole fruits and vegetables, and lean meat. But he had great results and was doing well, but of course he was doing well even prior to losing weight. And I think this just makes the point that very, very few people, in my experience, keep a highly specific diet long term. They may make significant changes in their diet, but they're not necessarily following a highly specific diet like a whole foods plant-based diet, a paleo diet, overcoming multiple sclerosis, whatever it might be. Now, this may be region specific. I practice in South Los Angeles. If I were in Santa Monica or Beverly Hills, it might be different. So this next patient was unusual in that she came specifically to the appointment not for medical advice, but she wanted to show me that her diet was helping her with her MS. She was approximately 50 years old, had had MS for several years, and she did a paleo type diet, gluten-free, dairy-free, a lot of whole foods, avoiding processed foods, and she was in fact doing quite well with very low levels of disability. However, her MS was sort of milder overall. She had an extremely low burden of lesions, sort of barely met the diagnostic criteria for multiple sclerosis, though I do believe the diagnosis was accurate. She had never had a significant relapse, so it's hard to say if it was her diet or she just had milder MS, but she was doing quite well. I remember her ambition was to make all of her old lesions go away, and I explained to her it was all just old scar tissue. It wouldn't go away, but as long as she didn't have significant symptoms, she didn't have to be concerned with it. The next patient I remember is a woman perhaps in her late 50s that had progressive MS for a very long time and had a significant amount of disability. Even when she first started seeing me, she could walk slowly with a walker and did have some further progression under my care, although relatively slow. Although people with significant disability, even a 10% decline can make a meaningful difference in function. Now, this woman was very strict with her lifestyle regimen. She kept a diet primarily consisting of whole foods. I don't remember if she kept a highly specific diet, to be honest, and she also exercised very regularly to maintain her condition. And I remember when I examined her and watched her walk, I thought, wow, this woman has very weak legs. It's amazing she's able to walk at all. If she was a little bit less healthy, she wouldn't be able to. So even if the diet wasn't helping her MS, it was certainly helping her overall health and mobility. Another patient I remember is a woman who I diagnosed with primary progressive MS in her early 60s, but now maybe closer to 70. And she had relatively mild symptoms at the beginning. In fact, she noticed her symptoms because she's very active. When walking long distances, particularly in the heat, her legs would get a little bit weaker. And she does in fact legitimately have progressive MS. She's never taken any disease-modifying therapy, and she has progressed over the years, but closer to the start of her diagnosis, she was actually able to train and complete a 50 50-mile walk. Incredible for someone with primary progressive MS to actually do that. She has worsened a little bit over the years, but can certainly still walk miles and lives a great life. She also keeps a pretty good diet, eating a lot of whole fruits and vegetables and lean meats, but definitely no specific diet, and even cheats with processed food sometimes, but has done very well. Now, I don't have a lot of vegetarians or vegans in my practice, possibly because they have a lower risk of MS, or maybe for reasons I mentioned earlier, just demographics of where I practice. But I remember I have one patient who's vegan. She's around 40 with relapsing MS, and she has low disability and has done well. And she's someone who is a little bit more naturalistic, prefers to avoid medications. She declined disease-modifying therapy, and she did have relapses and new lesions on MRI, and they were relatively non-disabling. She recovered from them, but she definitely had disease activity and later agreed to go on disease-modifying therapy and is still doing well overall. A long time ago, I had a patient who was perhaps around 50 who had relapsing MS for a long time, I think over 20 years, and she was doing very well with essentially zero disability. However, she was not healthy overall. She had a lot of potentially lifestyle-related medical conditions like high blood pressure, high cholesterol, type 2 diabetes, but she was doing great in terms of MS, not great in terms of her overall health. And I remember I actually took a 24-hour diet history. This is a technique doctors use where they ask you what you ate for breakfast, lunch, and dinner and snacks in the last 24 hours just to get a little snapshot of your diet. And I remember she was consuming a lot of processed food, and she said this was consistent with her long-term diet. And I talked to her about it quite a bit, and she seemed to be very appreciative of my advice. But then the following day, I got a nasty email from her, and I think some people just aren't appreciative of this type of thing, don't want to be confronted, or maybe I didn't do it in a tactful way. Anyway, this is an example of someone who doesn't necessarily have a great lifestyle or diet, but is doing very well in terms of MS. There's just a lot of random variation. Another patient I have is in her early 60s and has had MS for a very long time, and more recently has developed progressive MS. And she tends to be more naturalistic, prefers to avoid any kind of medical treatment, has not taken disease-modifying therapy for a significant proportion of her disease, if I remember correctly. Now, this is someone who lives very south of me, like in South Orange County, where people own a lot of land and may live a more active lifestyle. And I'll be a little discreet, but she actually has a profession which requires her to be quite physically fit and active. So she has had some progression over the years, has a little bit of difficulty walking long distances. Now, her diet and lifestyle are very good. She does not keep a highly specific diet, but definitely eats a lot of whole unprocessed foods and exercises very regularly and lives a great active life and is very cheerful and vibrant. She's actually no longer able to perform the full duties of her profession, but she's sort of semi-retired anyway, so it worked out for her. And she definitely seems to have benefited from her diet and lifestyle, even though she's had some progression of the disease. Yet another one of my patients had progressive MS that I diagnosed perhaps in her late 50s, and now she's in her mid-60s. So I followed her for several years. And when I first saw her, she definitely had some gait difficulty. Perhaps her timed 25-foot walk, how fast she could walk 25 feet, was around 8 seconds, definitely slower than someone without a disability. And she was started on highly effective disease-modifying therapy, and she did very well. She was one of those few lucky people who really had a dramatic improvement despite having progressive MS, and after 2 or 3 years, she was basically walking close to normal. So she did great, a superstar patient. However, at the end of that time, she decided she wanted to go more natural, didn't want to take medication, stopped taking disease-modifying therapy, and she started keeping a special diet, and she kept a keto paleo type diet. And I followed her for several more years, and she's continued to do very well. And she became increasingly skeptical of the medical system, even though she actually did quite well on medication and had no side effects. In fact, she had declined the COVID-19 vaccinations, and she actually decided to retire from her workplace. She had a job such that she would have to get the vaccine to continue working at a certain point, but she decided she didn't want the vaccine. She would just go ahead and retire, but she continued to do very well. However, when I actually spoke to her about diet, she wasn't actually that strict. She didn't seem to know too much about the technical details of the diet and was definitely eating some processed starches like tortilla, which obviously isn't either gluten-free or keto, but I got the sense that she kept a relatively good diet overall and definitely avoided processed foods most of the time and did incredibly well. Another patient I have is a young male who has aggressive relapsing MS. Perhaps he was diagnosed in his early 40s and had a rough time with the disease, acquiring a significant amount of gait difficulty even within the first few years of diagnosis. Now, this was especially frustrating to this gentleman because he always had problems with his weight and he was quite obese. He had a weight perhaps around 400 pounds. And right before he got diagnosed, he made major changes in his lifestyle and kept a strict ketogenic diet and actually stuck to it and lost, I don't know the exact amount, but well over 100 pounds. So his overall health was improving, he was losing weight, he was feeling good, and then he got hit with multiple sclerosis. And this was very frustrating to them. He continues to be a proponent of the keto diet and has a little bit difficulty maintaining it. He has gained some of the weight back, but he's definitely not where he was before. But in terms of MS, he hasn't done great. Now, it's very hard to remember stories. Even people, if I spoke to them about their diet several years ago, it's hard for me to really remember the details now. But to speak in generalities, I've had a lot of patients try a lot of different diets, and most people who make a major change, like they start a whole foods plant-based diet or a paleo type diet, do report some type of improvement in fatigue, in cognitive function, in general vitality. I would say the majority of people report some kind of obvious benefit. Again, it is my experience that it's quite difficult for people to strictly maintain these diets, so even though people may say they follow a named diet, the changes they make in real life may be a little bit different. The types of diets people are following seem to have changed over the years. When I started my residency in 2009, Dr. Roy Swank's low saturated fat diet was definitely the most well-known, and then Dr. Terry Walls and her modified paleo diet became incredibly popular and well-known, and maybe more recently people are more interested in ketogenic diets and intermittent fasting. My general impression is that people who try to improve their diet and exercise regularly tend to do better on average, but there's a ton of individual variation, and most people who are older, who have had MS for many decades and are doing well, don't keep a highly specific diet. From the perspective of a doctor, we prefer patients who are healthy overall. It just makes it easier for us. For instance, certain side effects from medication are well known to be associated with certain medical conditions. One example would be macular edema with type 2 diabetes for the pill Gilenya for MS, and for immunosuppressants like B-cell depleters, people who have more medical conditions are more likely to get serious infections, and with the trend to use stronger medications earlier in the disease and potentially for long periods of time, this is a serious concern. That being said, I can't say I've seen a clear winner. Like, it's not obvious to me that people keeping a certain diet are doing much better on average. But we are trying to get more evidence-based information on this. I'm working on a small epidemiologic study with Professor George Jelinek and his neuroepidemiology team at the University of Melbourne, and we're looking at people with MS over age 55, and we're seeing if there are any correlations between diet, exercise, sunlight exposure, vitamin supplementation, smoking, and other lifestyle factors, and disability and other quality of life outcomes, and hopefully we can give people with MS more evidence-based advice. Anyway, as I mentioned before, I hope you liked the video, and please share in the comments if you have MS. What has your MS been like? Have you tried different diets, and what are your experiences, and do you have ideas for other videos?